All right. Let's see here. So we now we're down just a couple of members, probably start joining soon. Morning, Jane. Everybody. So for the sake of time, let's go ahead and get started because I know that we have not a very large agenda today, but a lot to do today. So thank you all for those who are attending today. All right. So I know that we don't have a formal chair to lead this meeting since it's a special sessions meeting, and we are going to be voting on our officers today. So if anybody would like to volunteer to help facilitate today's meeting, basically just, help us keep on track through the agenda and things like that, we're welcome to volunteers. If nobody's feeling up to it today, I'm happy just to take the bull by the horns and keep the meeting moving. So I'll give some space now, see if anybody wants to jump in. All right. That's totally fair. I know it's kind of a little on the spot, so this whole meeting is a little bit on the spot, but hey, that's what the special sessions meetings are for, and we're going to get a lot of good work done today. So thank you all again for being here. So I'll just go ahead and do a quick roll call, and then we'll go over the agenda for today and see if any adoptions need to be made or if we can vote for those. So we have Karen Renee Anderson.
I'm sorry, are we recording? I'm bad at technology and administration. You all know this?
Yes, I think I heard the recording.
Okay, perfect. I'm trying to keep track. Thank you so much.
At this point too.
Perfect.
All
and
right.
Caitlin, real quick before you do roll call, I just wanted to flag for everyone, we do have an interpreter on the call. So you, if needed, you are welcome to pin the interpreter to your screen.
Thank you for that, Megan. All right. Ashley Castro. Okay. We have Dr. Rob. I see Dr. Rob. Good morning, Dr. Rob. Raquel Garcia. Good morning, Raquel. Carolyn Hall. I know that she was not going to be able to attend today. Tasha Komkar. Oh, no Tasha. I'm sure they'll be joining in a little bit. Dr. Ron Lee?
Here.
Good morning. All right, Maria Martinez. I know Maria is not able to join this morning either. Noir. Good morning.
Here.
Morning, Noir. Rana Shainer. Andrea. Thank you. Jamie. Thank you. Good morning,
Yep.
Jamie.
Hello. Good morning.
Let's see here. Cameron. Good morning, Cameron. See you on the
Yes. Good morning.
Catherine Washington.
Present.
Good morning, Catherine.
Good morning.
All right. Seth Watkins. Not seeing Seth on. And then Swin Whitestone. All right, everybody. So with roll call being done, wanted to look over the agenda and see if you all are comfortable making a motion to adopt today's agenda.
I move.
Second.
Thank you. All right. All right, everybody. Well, let's get down to it then. We're already ahead of schedule. Awesome. All right. So first for business is voting for our council officers. So let me see here really fast. going to. All right, we are not quite at quorum. So let's see here. So hopefully we'll have a couple more people join and we can kind of come back to this. Let's see. But yes, we will give it a little bit more time and we can come back to this towards the end of the meeting. I would really like to see if we can get a couple more people to join so we can reach quorum to do the formal vote. I will go ahead and let you all know that based on the officer feedback form that you all filled out, you have nominated Raquel Garcia as chair and then Tasha Kankar as vice chair. So again, that's based on the feedback that you gave us during the officer nomination form. So again, we'll kind of give it another minute or two to see if we can get anybody else to join. Give me 1 second, y'all. Sorry about this. Having a little bit of technical issues this morning. And then if anybody can reach out to, if you have any of the contacts of the other council members, to see if you can reach out, just to see if we can get a couple more bodies in today. Again, because we would just really like to get that quorum reached at least so we can do a formal vote. That would be wonderful. But yeah, so we'll come back to this after a little while, give some people more time. I know it's early on a Thursday, so I completely understand. So for the sake of time, let's go ahead and move on to our report. So that's the whole reason, most reason that we're here today is to keep working through this and get this finalized with the council as a whole. So I'm wanting to look at the agenda here. We have linked the annual report working document here and then a couple of the emails that you've received as well. And then we've also linked the video recording for each of the meetings. So you can kind of go back and review, how we've discussed this information, how we've come up with this information, how we're incorporating it into larger behavioral health systems as a whole, if you're interested in doing that. So all of the videos are linked there. I did want to pay a special notice on here, since we will not be meeting again as a council as a whole before the annual report is due. We are going to be submitting a digital voting ballot to you all. So you all will be emailed a voting ballot. It's basically just going to be another Google form. I know we do a lot of Google forms, but as right now, unfortunately, with time constraints and everything, this is like the most viable option that we have. So you'll be emailed a form by Wednesday, August 28th. You will have until end of day Friday, August 30th, to go in and vote. So the vote is going to be extremely simple. It'll just ask your name, your email address, and then if you vote yes, if you vote no, or if you abstain from voting. So just be prepared to keep an eye out on your email towards the end of this month, because you will be receiving that final copy of the annual report as well as the voting ballot. And then as voting members, you are required to participate. Even if you don't want to vote, please just select abstain from voting, so we at least have that on the formal record. Any questions there before we jump into the report itself? And some head shakes, no big red flags. All right, perfect. Well, let's go ahead and get into this then. I'll go ahead and increase this a little bit. Can everybody see this? Perfect. So here we just have our cover page, introductory to you all, and the annual report itself. Scrolling down, we have our table of content that's going to be divided into 4 different sections as laid out in the annual report template that this subcommittee has been using to help guide and create this annual report. So for section 1, we have the BHAAC introduction, which goes over the council's statutory requirements. It defines behavioral health according to state statute. So when we start referencing behavioral health within this report, people know exactly what we mean by that. And we'll go over the definition. So if you have any questions about it, we can answer it then. But it's kind of an all-encompassing term. So that way we don't have to specifically list, mental health, substance use, and things like that. It's just kind of that overarching term that we're going to be using here. Then we have the mission and vision statement, our lists of accomplishments that we can absolutely add on to if you all see something that might be missing. I know we kind of reviewed this in the last meeting, section 1, but we can go over it again briefly if you all would like. Next, we're moving into section 2. So these are our statutory recommendations. So these are the recommendations that are required according to statute. So we have the identification of underserved populations, the system-wide grievance system, performance monitoring system, and behavioral health safety net. And section 3, this is where we really want to hear from you all in your respective communities. So we're asking for additional recommendations based on personal and professional experiences. Though obviously we want to hear about you as individuals, we are asking you to kind of think about this in the realm of the larger behavioral health system as a whole. So yes, it can be, personal to you and personal to your individual communities, but how does this relate to the state of Colorado as well? So we're just really asking you to think about that when making any comments or recommendations to add to this annual report, that we just really want to be able to tie it in and make it applicable for everybody throughout the state of Colorado. Lastly, we have the BHAAC Regional Subcommittee Direct Feedback process. So as you know, we have been diligently working on the creation of BHAACs, and hopefully that will be up and running shortly. But in statute, it clearly states that the BHAACs are supposed to have a direct feedback process with this council. And so what we're asking for you all here, since the BHAACs obviously aren't created yet, you can't really advise on the BHAACs themselves. We're asking you, how do you want that direct feedback to look? This can be as simple as they join a meeting every quarter, check in with you all during the regularly scheduled council meetings. We can ask them, for a quarterly one-page report, really however you all want to receive that information and want to have that direct line of communication. So that's kind of what we're asking for you specifically within this section. And then the final section is just council signatures and approval. So that's where we're going to be asking you all to vote, and we'll be including your vote there. And then our chair and our vice chair, when they are formally nominated or when they are formally appointed, will just sign that. And then again, you all will receive a copy on August 28th, and you will have until the 30th to vote. So any questions about this before I start getting into it with you all? All right. And I just wanted to take a moment and really thank our report subcommittee. They have gone above and beyond to work on this. At first, we just were meeting bi-weekly, but then we realized that is not enough time. So we have increased to weekly meetings. They're taking a lot of time out of their schedule, not only to meet once a week, but then to do the extra research out of hours. And so I just really want to thank them for their time and commitment. I know this has been a big lift, but it's been extremely helpful, and we're getting a lot of amazing feedback that I really think we're going to be able to build on and use to direct the council meetings throughout the next upcoming year, and really be able to incorporate it into the BHA report and be able to give you all that feedback that you're absolutely looking for and deserve to receive. So just a quick shout out to all of them. I know that Tasha and Marie aren't here, but Raquel and Catherine, thank you so much. All right, so getting into the meat and potatoes. So we have already gone over this at the July meeting, but wanted to quickly review with you all and show you how we've incorporated some feedback thus far. So section 1, again, is going to be the introduction of the council. This is basically all statutory language. So we can change a couple of things about it, but it mostly is just taken, copy and printed from statute. So we don't have all that much power to change the language unless we want to take this back to legislation. But since we don't have the time to do that at this moment, this is what the introduction of the council is. And then coming down here to the behavioral health definition. So again, this is directly from statute, and we have listed the statute down here. So it's 2750-101 parentheses 1. So again, this is going to be kind of like our overarching, all-encompassing definition. It's going to include substance abuse disorders, mental health disorders, serious psychological distress, serious mental disturbance, and suicide, and a range from unhealthy stress or subclinical conditions to diagnosable and treatable diseases. Any question on that for right now? Sounds good. All right. Now moving into the mission statement. Again, we talked about this at last meeting, but we incorporated some of your all's feedback, specifically around, the wording of what we see this council as doing. So previously we just had the word advise, but we also wanted to kind of build on that a little bit more. So right now, based on your feedback and how we incorporated that, the mission statement reads as such. The mission of the BHAAC is to advise, inform, and support the BHA in developing a comprehensive, cohesive, and accessible behavioral health system across Colorado. We exist to identify gaps, reduce disparities and discrimination, recommend improvements, and support policies that promote well-being for all people of Colorado. By co-creating and leveraging community-driven data and insights, we strive to enhance accountability, transparency, and effectiveness in delivering behavioral health services. What do we think about that? We're really trying here, to get all of Colorado, not really just like specifying one specific demographic or anything like that. And then really just strive to show how we are advising, informing, and that co-collaboration aspect as well.
Can I speak, Caitlin?
Yeah, absolutely. Please.
Yeah, I really do. We really wanted your input on these. I mean, we're only, a small think tank in there. So if you see anything that needs to be changed or anything we forgot, last year this was kind of done in the dark and we didn't want that this year. So we wanted to make sure that we brought some of these spaces to light so that you guys had the opportunity to give input.
And
you're not hurting our feelings.
Yeah.
It's okay.
Not at all. You all are made commenters on this document as well. So you have the link. You've been sent it a couple of times, and we can drop it again in the chat just for reference. But you all are able to go in and make comments. So to do that, just if there's like a section, let's say this, just right click on your mouse, and then you can go in and make a comment. And then that way we can see any comments, questions that you might have, and work to incorporate those. Jamie?
Thank you. Thank you so much for all the work on this. This is really, really great document. And as I was reviewing it, I was like, I really need to provide feedback so they know I actually read it, but it's really well done. And I do have some feedback on the later section, but the mission statement I think is great. I was kind of the one that brought up the word advise at the last BHAAC meeting, and I think we talked through that, and I'm great with that. I think you did a good job on the mission statement.
Awesome. Thank you so much for that feedback, Jamie. All right. So moving back to our vision statement. Again, work to incorporate some of the feedback that you all recommended during last meeting. So now our vision statement reads that our vision is to lead Colorado towards a future where every individual has access to quality behavioral health services as defined by statute that are inclusive, equitable, and culturally competent. We aim to eliminate barriers to behavioral health care by innovating, educating, and advocating for policies that not only meet the current needs, but also preemptively address emerging challenges. Through our efforts, we aspire to systemic change that uplifts all communities with an emphasis on underserved communities, priority populations, and communities with highest disparities, ensuring that behavioral health is recognized as a crucial element of whole person care. Again, for priority populations, the definition is going to be linked here. And so if you have any questions around that, please feel free to reference statute. That is again linked at the bottom of the page, and I scrolled a little bit too far. There we go. So, any questions, comments, concerns about mission, or excuse me, vision statement right now?
Hey, so this is Rob. I got a question. So when you're saying advocating, right? When we're saying like, are we saying advocating in just this meeting? Are we saying that we can advocate outside this meeting as a BHAC member? No, same thing with co-creating, right? There's like a lot of really well-written, the verbiage is great. It sounds great. But practical application into what it says, like, I just want to be sure that when we're saying advocating, like, are we able to advocate as a BHAC member outside of this meeting? You know, so I guess that's the only thing I just want clarification.
I mean, I definitely see you all advocating outside of this meeting because you are members of this council. You know, if you weren't trying to advocate for your respective communities, you know, I don't think that you would even be willing to join a council and advisory and council to advocate on behalf of the needs of your community and the communities of Colorado as a whole. I think that I definitely see what you're saying, with like a fine line of like, where do you sit as an individual versus a council member? So we could probably work to clarify that a little bit more if that is a concern that's raised. But yeah, I do see, you know, your roles kind of interlapping, and then maybe just a little bit more clarity as to when you are being presented as a council member versus just an individual.
Well, I think this goes back to like the Denver Post calls.
Mhm.
Am I able to advocate and announce that I'm a BHAC member and advocate on behalf of the BHAC? Do you know what I'm saying? So that's when you have terminology like advocate, you know, I just want to make sure that we have an understanding of what that means.
Anybody else? And thank you for that feedback, Dr. Rob.
I love what you said, Robert, because I think too, which I called you Robert because I'm looking at your name. That was weird. Like that was strange. It just felt weird coming out. Anyway, I think that's a good question. And I want to say that like for me, like my experience is I don't know how to code switch very well. So you know, I feel like I'm the same advocate in this space where I'm going to use that my experience in my community to voice my advocacy here. It's kind of, I'm hoping that's why we want to be at these tables, so that we can, I don't have to differentiate myself because I am the community. So, but I do think it's important to ask clarity there too, just to make sure we don't, you know, get kicked off council because we did something we weren't supposed to. So I think that's smart, but I think that I'm hoping that's how we're able to use our voice in this space.
I would love to work with you all to clarify this more in the bylaws as well, because we do really appreciate all of your input and your value, but want to make sure that we understand the distinction between you as a BHAC member and your roles and responsibilities there versus you as an individual or an advocate of your individual communities. And yes, of course, there's always overlap, but really just wanted to make sure that you all understand your roles and responsibilities and to protect everybody within this council as well. I know that some of you, you know, have some professional experiences that we honor and respect, and just want to make sure that every council member feels supported and comfortable and protected. And so that can be something that we can lay out further in bylaws as well. I know that nobody really, besides Dr. Rob, was able to attend our bylaw office hour, but I'm going to be holding more. So those that are able to attend, I really encourage you to, because this is the exact kind of feedback and information that we need in order to continue to build out those bylaws and make them unique to this council and the needs of the council. So I will be sending out more calendar invites for anybody who's able to join. But I think that's great feedback and something that we could really use in bylaws as well.
Yeah, I'll just say one last thing, like also, like, we don't know the BHA stance on everything,
Right.
right? Say I'm advocating on behalf of harm reduction and safe drug supply, right? And I'm saying, like, we shouldn't be involuntary commitment or emergency commitment anybody because they should have the autonomy to live their life the way they want to live. Does that contradict the BHA? So I'm advocating, right? And then if we are we co-creating those aspects of like the harm reduction programs and involuntary commitments, emergency commitments within the BHA? So for me, when I hear that, like, I go, well, I have like my version of what I think advocating is. Does that ever contradict the BHA? Probably it does. So that's just where it made my spidey senses tingle, I guess.
Absolutely. Well, thank you for your spidey senses. All right. So for the sake of time, does everybody feel comfortable with us moving on? Perfect. And again, just a reminder, you all do have commenting access to this document. So please, if there's something else that you feel that needs to be included and what we've covered so far, don't hesitate. Just go into the document and make some comments. And when making your comments, again, please just think about it within the realm of behavioral health systems as a whole, and kind of give a little bit of explanation as to, why you're exactly making this comment and how it can tie back into the larger behavioral health system. All right, so moving into accomplishments. Again, we've already kind of discussed this, so we'll kind of briefly go over this, but please, again, feel free to make any comments in the documents, so we can really move on to section 2, which are the big statutory requirements of this report. And then we want to have time for section 3, where we can start hearing some of your individual feedback as well. So the first accomplishment that we have is the relationship development between BHA and BHAAC. Basically that we have strengthened our communication channels with you all, and that you are encouraging more inclusive and equitable conversations during the rulemaking process, and request a performance feedback process that exemplifies how council recommendations are being implemented into the larger behavioral health system. The last time here, you all had made a comment about the feedback loop. So we wanted to change the wording on that and be specific about a performance feedback process. So what we're meaning by that is, presenting you all with information, giving you all the time to discuss and make those recommendations, us incorporating those recommendations, coming back to you all, showing you how we've implemented those recommendations, and then just continuing that dialogue, that circular dialogue. So wanted to just kind of point out that exact terminology that we adjusted to address the concerns around a feedback loop. So again, if you have any comments or concerns about that, please don't hesitate to make any comments in the document as well. For cross collaboration, we have said that we have that this council is composed of an authentic, diverse, and unique group of members, consisting of persons with lived experience, safety net providers, nonprofits, and community-based activists. There's been an increase in collaborative efforts with state agencies to facilitate a multidisciplinary approach to addressing behavioral health services. And there's been an increase in collaborative efforts among council liaisons. Some of the recommendations that you've had regarding this cross collaboration specifically is around clearly defining the roles and responsibilities of these council liaisons. I know Dr. Runley, we had spoke about that, and I have your email that we're going to be working through together. Please don't think that I've ignored you. We just have a lot of annual reports due in a very short amount of time, so it's a statute, and then we're going to get down to it all, I promise. So that is coming. Keep an eye on your email. But yes, the roles and responsibilities of council liaisons, demonstrating that cross collaboration effort more, and then we you also this council had recommended specific state agencies that we would like more collaboration from and more communication from, with those being specifically the Department of Healthcare Policy and Financing, the Department of Education, the Department of Human Services, Disability Services, Veteran Support Services, and Indigenous Community Liaison. Amy.
Again, this is really great work, but this is kind of the first area that I had maybe some comments, maybe just to float by the group a little bit. Because I absolutely agree we need to increase collaboration with the agencies that were listed out there. And I don't know exactly what increased collaboration means. To me, it could mean streamlining efforts when possible, being more consistent in service delivery across the board. So you're not getting something different if you're going through HCPF versus through the BHA. So maybe adding a little specificity around what cross collaboration and increased collaboration could mean. And then I also know that throughout the document, we haven't specifically called out the RAISE because their oversight agency is HCPF. But I feel like it's a missed opportunity if we don't specifically say the RAISE, because they're going to be so hand in hand with the BOSSOs that really, I think, we just need to like highlight that and say for equity purposes, it doesn't matter if you're going through the BOSSO or the RAI, you're expected to get the same service regardless of the payer source. So I guess I would like to specifically call out the RAIs, even though they're contracted with healthcare policy and financing.
Makes sense.
Well, I think you're right, Jamie, too, because there is a definite, they've all run independently. So if you are a statewide provider like I am, then trying to get through those they all have different ways. It has taken me a year to get through two. I mean, it's just, it's not equitable for small organizations, and it's not going to help rural communities at all. And because there's the disparity even in pay. So I agree. Good, bold conversation, Jamie. I'm glad you brought that up.
Yeah, thanks.
I was just gonna add on to these great comments. I do think like as we define the roles of the liaison, it'll become clear, right? What are the entities that we should be collaborating with? What does that collaboration look like? Is it providing information? Is it being aware of what's happening across agencies or the RAIs or the counties or the governor's office or the AG's office? There's just a lot that's happening outside of the BHA. And I think for the BHA to have liaisons to each of these, it's like the other agencies are not necessarily asking for a BHAAC liaison, right? But we do feel like it's important. And I think especially the way that the BHA is set up now, it just, I mean, from the outsider's perspective, you can't see where those formal connection points are. So I think if we spend some time and define what that role could be, and then you'd have to, ensure that the other agencies and departments and RAIs and entities are also understanding of that role. That would be a helpful first step.
Yeah, I think that's a really great point. I also just wanted to highlight, just specifically something that happens in my world is on the independent assessment process to get high acuity youth into QRTP placements. The process is totally different, whether you're child welfare involved versus you go through the RAI and you're privately insured. And that's what I talk about with streamlining processes. Your appeal rights are different. The entire process is different. So how do we take one process, the independent assessment, and apply it consistently across all of the entities? So in your note there, Caitlin, when you said consistency and communication, I think maybe, streamlining, we could add that in somewhere as well. Where streamlining where appropriate, or, when we can.
Sounds good. Thank you for that feedback. And again, this is not going to be the all-encompassing list on who we're going to be working with. This is just going to be our jumping start for the next year, and we could have literally every state agency in the future, and absolutely we'd love to do that. But realistically, what we can accomplish within this 1 year, I think that we can really start developing those communication channels and that interconnectedness with these specific agencies, and use that kind of as our foundation to start building out and linking out from there. And when we start having these more collaborative conversations and dialogues, we will start saying, oh yeah, we need to meet with X, Y, and Z. And that's absolutely something that we'll be able to bring in and make recommendations in the future. So again, kind of using this as like our guide for the next year and the conversations that we want to be having and the input that we need from our external external community partners and state agencies as well. So thank you so much for that. All right, the creation of subcommittees and working groups. So again, we've created lots of subcommittees and working groups. However, we are looking to do an audit for the ones that we have, currently listed on the BHAAC website and within the previous bylaws, just to make sure that they are still relevant and needed within this council. Absolutely, if they are, we can continue those. We'd like to get more participation from council members to get those kind of back up and running. Or if you all think that, maybe that they've served their purpose and there is another subcommittee that we need to create to focus on a specific topic, issue, demographic, we absolutely can do that. So we'll plan to kind of do this when we have new members join the council in a couple of months, and we'll just take a council meeting to use that as a refresher to go over, training, bylaws, this annual report. And we can do that with the subcommittees as well, just kind of, do an overhaul, all arching cleanup of the council and kind of get ready for the next year and what we need from there. So I wanted to point out that with specifically regards to subcommittees and working groups. And then last we have the submission of the 2023 report, which was amazing. I know that last year, from what I have heard, that it felt, very rushed and put together and just not a lot of structure and communication. And so that's something, even though all of that happened, you all still did it. So that is amazing. I think that's a huge accomplishment. And then, again, we're working to rectify some of the recommendations that you have here about, just specifically having more structure and support from the BHA, which is something that we're trying to do this year. And, we've had this year as a learning curve too, and we can start earlier next year. We can start, implementing different things that we need and assigning tasks in different ways. So we're still learning, we're still building with you all. But I think that it was an amazing accomplishment that you did the dang thing and got it in anyways. So thank you for that. All right. Moving on to our statutory recommendations. So again, this is specifically outlined in statute on what this council is supposed to advise on. And there are the 4 statutory requirements. So the first one is the identification of underserved populations, and then the statute references listed there. So I really like to point out this specific bullet point. So in talking with Andrea and some of my other BHA colleagues, and then this council as a whole, we have not provided you all with that information to necessarily advise on how the BHA is approaching the identification of underserved populations. So here we have specifically said that, that we have not provided you with that information that you need to establish that performance feedback process that we're looking to get, where we present you with information, you provide us with feedback, we incorporate that feedback, come back to you, and continue that cycle of recommendation and incorporation. Basically, we're just saying as soon as we have that information to provide that to you, we want to have these conversations. Good morning, Tasha. Thanks so much for joining. So what we ask specifically of this report subcommittee is, once these conversations do begin, similar to how we're asking for the BASO, how do you want to receive this information? How do you want these conversations to look like? And so here, the council specifically asked for feedback processes that include presentations and updates from BHA leadership during the regularly scheduled council meetings, which is something that we're doing now and continue to do, and be more specific in our deliveries and, just how we're addressing some of the concerns around some of the specific topics and issues that you all have brought up. And then in addition to that, we've also asked for a biannual 1-page report that includes that information that is discussed in council meetings. So that way you have, both a written copy as well as like a verbal and visual communication that you can reference back to in both of those types of ways. So that way, you know, if you're more of an audio learner, you can go back and listen to recordings. If you're more of a visual learner, you can go back and reference this one-page sheet and see, you know, how the two kind of overlap. So that, as well as working to establish working relationships with the newly hired community engagement regional specialists, and really be able to define that cross-collaborative nature of these relationships. Tasha?
My question is how exactly are these bossos supposed to be handling? Like, are they handling like the service coordination throughout the whole entire regions?
So we're not on BOSSOs yet. We're just doing the identification of underserved populations, but BOSSOs will be down at the end. And
Okay.
then if this was something that you we had talked about yesterday, just shoot me over that email if you can.
Because all right, because I talked to them yesterday, so I'm just trying to figure that out because that is a concern of mine on how that is going to be
Yeah.
handled throughout each region. So thank you.
Yep, and we can definitely address that later during the BOSSO section. So anything else about the identification of underserved population? This is going to be our smallest reference or smallest recommendations for the statutory required section, just because we haven't had these conversations yet and delivered any sort of information for you all to review and make recommendations about. So again, we just wanted to clearly state that and then talk about when these conversations happen, how you want these conversations to look. Is there anything else that might need to be added in addition to, you know, the updates during council meetings, as well as an annual, like a biannual one-page report? All right, not seeing too much right now, so for the sake of time, we'll keep moving on. But if anything comes up, again, please feel free to go into the document and make some comments. All right, next moving into the system-wide grievance. So how we have these sections lined up so far is the first bullet point is going to kind of explain how you all are understanding what these topics are. So the first bullet is going to be how you are understanding the system-wide grievance system and what you understand it to be. The second point is going to be how you've been informed about the system-wide grievance system and some of your recommendations there. And then the third bullet points are going to be your additional recommendations, which we'll go through and break down into a little bit more detail. So for the first bullet point for the system-wide grievance system, we have written, based on the information provided to the council understands the system-wide grievance system as a critical component to the statewide behavioral health system. The council understands that the system-wide grievance system is a structured mechanism for addressing and resolving complaints within Colorado's behavioral health system and increases accountability and transparency. The system-wide grievance system helps to identify systemic issues and areas for improvement and contributes to the reformation efforts of an inclusive, accessible, and equitable behavioral health system for all Coloradans. Is there anything else that we need to add to this? Anything that we need to clarify about your understanding of the system-wide grievance system? Is this something that you completely disagree with? You know, do you understand it to be something entirely different? All right, not seeing too many red flags, so that's a good sign.
Sorry, Caitlin, I didn't get my hand raised. I apologize. Just as a reminder for me, so when we say for Colorado's behavioral health system and, you know, the behavioral health system for all Coloradans, the grievance system also does apply to the RAISE, right?
Andrea, I'm going to refer to you on that one, if that's okay.
Yes, I can't believe I found the raise hand button that fast. I was just going to jump in anyway, but I'm very proud of myself. Yeah, this is the grievance system. It's that standard operating procedure that involves how we intake complaints from any intermediary, any provider, any state agency, right? It really is the one front door to get that to the BHA. And it applies for RAISE as well. So I will put that in the chat as well. That might be helpful, the link to it, so you can follow along, but it is all payers, all everybody, to your point.
Any other questions? All right. So moving on to our second bullet point. Again, this is how you all have been informed of the system-wide grievance system, and then some of the recommendations you have about that. So the council is informed about the system-wide grievance system through presentations during regularly scheduled council meetings, state newsletters, state websites, and Q&A sessions. Though the council has been informed about the system, we are requesting more frequent updates from BHA leadership about the system, its current state, and future goals for improvement. We are requesting quarterly updates during regularly scheduled council meetings that support the performance feedback process by demonstrating how council questions and feedback are incorporated into the system. Does that make sense? Is that agreeable? Because I know during some council meetings we've had, them come in to speak, and then we've had follow-up conversations. But again, being more intentional about these conversations, about letting you all know, this is the previous conversation we had, this is how we've done it, what other conversations are needed, and making sure that we are being really specific and detailed within that performance feedback process. All right. Not seeing any big red flags, so for the sake of time, we'll keep moving through. So some additional recommendations that you all had about the system-wide grievance system. So going back and listening to, some audio recordings and video recordings of these council meetings, and then working through this report subcommittee group. These are some of the things that we've recognized that need to be incorporated and addressed, and we would like to see incorporated back into the larger behavioral health system. So the first one is that we would like to ensure that all grievances from all demographics, particularly the underserved and historically marginalized populations, are being captured and then addressed to confront systemic inequalities and increase public confidence in behavioral health systems. We recommend partnering with community organizations, local leaders, advocacy groups, and regional specialists to raise awareness and disseminate information about the grievance-wide system grievance process in underserved communities. We recommend using a variety of communication channels, such as traditional media, social media, community engagement events, and printed materials to increase community engagement and education. Furthermore, we recommend that all messaging and materials are created to be linguistically acceptable and culturally inclusive to ensure community engagement and understanding. So in this bullet point, the report subcommittee really wanted to emphasize, getting the information out to communities, especially historically marginalized and underserved populations that often lack even just like the education and the resources to be able to access this kind of information. So you all gave some examples on different ways to do that, such as, the different communication channels, the different partners that you can reach out to, and really just making sure that messages are clear, they're digestible in language that is understandable for all, and they're also culturally inclusive to make sure that these communities understand the information that's being presented to them and feel comfortable accessing the information. All right. Not seeing any big red flags here, so we'll keep moving on. The next recommendation that you all had is to implement a comprehensive qualitative metrics that track the type and frequencies of grievances, resolutions, response times, and outcomes to improve the system-wide grievance system process and identify systemic gaps and areas for improvement. We recommend working with stakeholders to identify key performance indicators that measure systemic effectiveness and establish a more user-friendly platform that displays aggregated data and key insights for more public engagement and increased transparency. Furthermore, we recommend creating an automated response system that informs the filing party that the complaint has been received and provides an estimated response time as well as additional information and resources. We recommend a response time of 10 to 15 business days. So specifically with regards to this, just looking, at the BHA website, having to, navigate to find exactly where you can find the grievance system was one concern that was brought up by the report subcommittee. And additionally, after you file a grievance, it doesn't really show, how your grievance has been filed, when you should expect follow-up communication. And so that's why they recommended creating that automated response email to say, thank you for submitting it. We've received your information. We'll be responding to you within a certain period of time. In the meantime, here are some additional resources and information you can access. What do you all think about that? Is that agreeable? Is this something that you all also find necessary and relevant?
I think it looks fine to me.
Thank you, Jamie. Perfect. All right. Well, again, if anything comes up, feel free to go in and make some comments. Next recommendation is to provide ADA accessible accommodations for the system-wide grievance system to ensure that the system is accessible and comprehensible for all persons of Colorado. We recommend that BHA have multiple methods for grievance submission through online forums, phone, mail, and in-person submission. Additionally, we recommend that the BHA develop a supportive hotline to facilitate any ADA accommodation requests and to produce materials that are available in large print, multiple languages, and are accessible to screen readers. So again, here really highlighting that ADA component and that accessibility component. The state is working to, especially our communications team, we're in the process of expanding and hiring an ADA website specialist. So we're going to go in and do deep dives into all of our websites, all of our landing pages, and make sure that they are accessible to screen readers, but also making sure, in this recommendation that they're linguistically inclusive as well. So if you are a primary Spanish speaker, you'll be able to access that information in your native tongue, and then also large print availability as well. Any concerns, comments, questions around this? All right, moving on. Another request is to enhance transparency and increase trust in BHA efforts by documenting and publishing system-wide grievance system protocols regarding how grievances are handled, estimated response times, and outcomes. We recommend creating a variety of multimedia resources such as brochures, infographics, and video recordings explaining how to access and use the system-wide grievance system and to keep public stakeholders informed of outcomes or changes made to the system. So again, trying to increase our transparency efforts by showing, kind of like a timeline from, the time that a grievance is filed to the time it's responded to different modes and methods of resolution, and then quality of resolution afterwards. So being able to access that information, through the Performance Hub and get a little bit more of those qualitative metrics to show, exactly how this process is outlined, exactly what is done within these processes. Again, some of the frequencies of grievances filed, if we're starting to see trends in certain things, that can be something that we can, identify and address in future meetings and conversations. But again, just trying to really increase that transparency effort by just getting more information publicly available. All right. And lastly, with regards to the system-wide grievance system, we have offer support to services to assist individuals navigating the system-wide grievance system. We recommend partnering with legal aid organizations and other local community advocates to help educate members of the public support about their rights and options regarding grievances and service support. So again, just kind of going back into the respective communities and making sure that everybody is educated about the system-wide grievance system, you know, how to file a complaint, what their individual rights might be, and then just, again, working with community partners such as, you know, legal aid organizations and any sort of community advocate that might be an access and tool for community members to reach out to in order to learn more about how to file a grievance and things of that nature. Any comments, questions, concerns about this? All right. Again, please go in and make some comments and things. If this is something that you all would like more clarification about, if this is something that you know you strongly agree with, you strongly disagree with, if there's some additional recommendations regarding the system-wide grievance system that you feel have not been addressed, we want to hear from you all. This is not just the report subcommittee's report. This is the entire council's report. So if there's something that you know you strongly disagree with, you have strong feelings about, regardless, support, disagree, whatever it may be, we want to hear your feedback from. So please don't hesitate to go into the document and make some comments there. All right, so moving on to the performance monitoring system. So again, how we have this outlined is how you understand the performance monitoring system, how you've been informed about it and some of your recommendations, and then additional recommendations. So first we have, based on the information provided to the council understands the performance monitoring system to be a services assessment tool that aims to increase transparency and accountability of behavioral health services throughout the state of Colorado. By collecting data that tracks the capacity and performance of behavioral health providers throughout Colorado, the performance monitoring system provides insight into the delivery of services, determines best practices, and identifies metric gaps and areas for improvement. Is this how you understand the performance monitoring system? Is there anything that we've missed? Is there any questions, concerns that you might have?
I mean, I do. Sorry. I'm going to throw this out there. Like, when is all this happening? Do you know what I mean? Because it hasn't happened. So is this, I understand why we're putting this in there. And I know that's not on you, Caitlin. I know that you're new to this. Like, it sounds great. But if we're going to put it in writing, I also want to know, like, and I guess that could wait, is implementation of when this is happening.
Definitely. So I know, especially we talk about it down here more about like the performance hub as it specifically relates to the performance monitoring system. But Andrea, feel free to jump in.
Yeah, I was gonna say this is, and I know this is, I'm trying to not conflate it with the grievance system, although the grievance system is part and parcel of the performance monitoring, which is like larger, right, and more encompassing. We did turn on a lot of these metrics and the performance hub, like as of July 1 this year. So we're starting to feed those metrics and data points in from some of our licensed entities. That's what I assume Jordan Bass and Rhea Singh may have come and spoken to this council with, as opposed to the grievance system, which is more that SOP that we were discussing earlier. Does that help?
So no, yes,
Okay.
yes and no. So I guess what my question is, when are we going to get this data? When will we be looking at it? Will we be doing it in the meeting, like when we have our quarterly meetings? Will we be discussing, you know, in open forum, like the complaints that are coming in, the data that we're getting? Like, how will this be given to the council? Like, I really want to make sure that if, you know, if I'm going to be a part of this council and these are the things that we're saying that we're going to do, that we're implementing them and doing them, and that we're advising and co-creating. And I'm just going to throw this out there, like we're putting in writing, that doesn't happen when we have a meeting and read off a PowerPoint. That's what I've been a part of since the beginning. So I don't know how, when I'm reading this, I like it. I love what it's saying, but when is that going to happen? Because I think I don't want to speak for everybody, but it hasn't happened. So we're putting all this in writing. So I'm cautious to like sign on to anything that I don't feel like we've had an opportunity to implement or even be a part of or do. So this, when I read this, what I'm reading in my interpretation is that this council is 100% going to change from everything it's been so far, because that is what this is saying, because that is not what we've been doing. So I just want to be clear and understanding that we're signing off on this. That's what we do. I love it. Like, if this is what we're doing, I'm all in, but let's do it because we're putting it in writing.
Definitely. And that, again, we're going to be using this guide to kind of help guide us in our future meetings, our goals for this council for the year, to have these conversations with these key stakeholders that we need. So I know some previously that Jordan Bass has come and spoke to this council around the performance hub and, how to access that and use that. But we do need to have, again, going back to that, performance feedback process. It's not just us giving you information, it's giving you all information, giving you time to digest that information, giving you the space to make these recommendations, us incorporating those recommendations, coming back to you all to show you, this is what you said, this is what we've done, and having, again, that process as opposed to just information overload. Thank you. So I completely agree, and we can address how these meetings are held in the future. If slide decks we're not feeling that those are relevant anymore, we can absolutely readjust to best serve the needs of this council. So I completely understand what you're saying there, and we need to have more conversations around the performance hub. What you've been exposed to so far is just the beginning, and we want to have, again, continued more in-depth conversations, more feedback, show you all how we incorporated all that feedback. I see a couple of hands on my screen. I don't know who's first. I think Ron Lee, maybe you.
Yeah, sure. Yeah, Dr. Rob, I'm glad you brought that up. And Caitlin, thanks for the response. And, I do remember when they came to show us the Performance Hub, and this was what it is. And we had a lot of feedback for them. And I've been playing around on the Performance Hub, and it's essentially a count of service delivery, encounters, claims date, claims information. But you look at each of those words, right? Insights into the delivery of services. Maybe you could say check like some very crude rates, right, of service delivery. Doesn't determine best practice, doesn't identify gaps potentially in areas for improvement in a nuanced, real way. I think probably what we see throughout the report and all of our work is that, do we check the boxes? Sure, we could check some boxes. Is it very aspirational? Every single word from the vision all the way down? Yeah, it's very aspirational. And then when it comes to that sort of like, how is that our feedback being incorporated into the next iteration of Performance Hub? I think that's where we've been lacking. Like we get a quick glimpse of all these things, grievance, even the grievance. I mean, all of those, if we implemented all of those points, that would be amazing. Right? Love to see how that gets followed up. But in terms of this one in particular, this is how we show that it's an effective system and that it's really improving in the ways that it needs to improve for all Coloradans. So I just echo yes and no for all of these things, right?
Absolutely.
Aspirational, and we'd love to see the detail and be a part of that.
Absolutely. And that's, again, going down, as we continue to go down further into this, you'll see some of the recommendations around that incorporation of that feedback process that we haven't had thus far, to a way that you all feel that your recommendations are being addressed and heard and incorporated. And then about the missing metrics, about, this is the goal of the performance monitoring system, overarching, but in order to actually get there, these are the recommendations that we need. And these are the implementations that need to be done in order to, identify metric gaps. That's part of this council, and that's part of what you have been going through in these recommendations, as you'll see, is the missing demographics, the missing metrics that we're not including about, you know, more qualitative data as opposed to quantitative data, and you know, the services being, the quality of services being rendered, and you know, the accessors of these services, are they accessing services multiple times? Why? You know, and so those are some of the metrics that the Performance Hub is missing right now. And in full transparency, we understand and agree with that. You know, we're the Performance Hub is doing quarterly updates to incorporate more information. This is just square one, and we have a long road ahead of us and a lot more to do and build. And that's why we want to have these more in-depth conversations with you all. We want to get more of that feedback, because we know that this is not all-encompassing, all-inclusive at any point in time. This is just the beginning. And we need to have these conversations and recommendations in order to continue to build it out and make it a system that determines best practices and identifies gaps and areas for improvement.
So
Andrea?
Caitlin, I do want to ask again, like there's it's, and maybe when we go down further, it'll explain, but you say like we're advising, or sharing, but to who? To you and Megan? I mean, do we have a designated person that we're bringing this back to? Is it, because it feels like when we always say we're giving feedback to the BHA, right? Like it's like the Wizard of Oz, the guy behind the curtain that we all don't know exactly who that is. Who are we giving this information to? Who is our designated person that we're giving these recommendations to? And so we could understand how they're getting, you know, like we're in this meeting, say we're discussing some of this stuff. It just says that we're advising, but to who? It can't just be the whole BHA, because we're not advising the whole BHA, because a lot of people that work for the BHA don't even know each other, right? And so how do we know who we're reporting to? And I'm not trying to be difficult. I just feel like we've been in this for a couple years, and I just would love to see it like solidified and implemented, but with some like short-term goals and some short-term, like just so we could see like that we're actually progressing forward and not just treading water. And I think that some of the vague language, like we're reporting to the BHA.
Right.
That's pretty big, like.
Right. And it leaves room for the ball to be passed and dropped. And that's something that we've recognized and are working on. So I'm going to use one of our other councils, BHAAC, for an example. They just submitted their annual letter of recommendation. And what our leadership has done is they are reviewing the information, and we've broken it down into different brackets. And right now, leadership is determining who is going to be responsible for which individual recommendation, which I'm assuming we will do something very similar with this annual report too. So this is going to be submitted to legislation with the comprehensive BHA report. I believe it's due in October, Andrea. So that is going to be implemented. So legislation is going to see this, commissioner is going to see this, all that's going to be done. Then I think what our plan is going to be working with our directors and our leadership to start designating out tasks, you know, so when it comes to like Performance Hub, we're going to get more of the data team in here and things like that. So we'll be able to, and then of course, bring this information back to you all to show, you know, based on these recommendations, this is how we have it divided. This is who is going to be responsible for it. These are, you know, the times of years that they're going to come and speak to you all, give you all room to ask questions. Then they're going to have a follow-up meeting in a couple of months to show you, you know, how they've incorporated your feedback so far, what the future plans are, if any adjustments need to be made, and things like that. Andrea, please correct me if I'm wrong on this, but this is what I'm seeing being done with BHAAC. So I'm assuming that this will be very similar to how we address this as well.
Yep, it's again at the will of the council at large and how they'd like to see this run in general. I was going to say, I think we can also get a lot of bandwidth this year out of agenda setting through executive committees and that sort of thing. Dr. Rob, to your point, to say, okay, so the October agenda or whatever it is every year, we know that this report just came out. So we want to talk about Performance Hub in our October meeting, and like that will, I think, help establish this, how we, the Royal BHA, are reporting to you guys on our timelines, because it'll make more sense just on some of our deliverables when you guys want to have those meetings and discussions. So I think with some of the structures that Caitlin's helped put into place with the bylaws and the subcommittees, that you'll get a lot more information in a more timely and relevant manner to that, so that it doesn't look so much like a checkbox, because it's happening at the appropriate time during the year. Does that make sense?
I think this sounds great, and Caitlin, we appreciate it. Like, you know, at least we have like a template that we can.
Yes,
hold
and that
on.
was something that I was, So working with the executive subcommittee, I want to start implementing like an annual calendar. And it will be just kind of like a bird's eye view, but like, okay, so this is due at the state at this time. So let's have a conversation about it in this, so we can really start using this report as a guide. Also, state timelines as a guide, and we can kind of create that bird's eye overarching view for the next year on the conversations that we want to have, the goals that we want to achieve, when to start working on the annual report based on the amount of time that we need, all that kind of stuff. So that's something that I absolutely want to work with the executive subcommittee to create, and then of course bring back to you all as a whole to make sure that it's understandable, that it's agreeable with the timelines and timeframes and things like that. And then really kind of use that to build out on the next year. Tasha?
When it comes to, I don't know if we just hop subjects, but back to the subject for the performance monitoring and the grievance, I just want to know, how is these 4 regions, coalition people, I don't know what is their duty, what their title is, Megan, for those, and then with the FVC, BHA, FVC, coalition groups, how are they going to report? Like, because are they going to be like working with us so we can inform the BHA? Because that's what I would really like to know, how that's going to go down, especially when it's with the grievances, with the performance monitoring, like with it all the way across the board. Because I don't know how that's going to do. So how are we supposed to report to the BHA? That's what I'm wanting to know.
Tasha, I just want to make sure that I'm understanding your question too, for Megan as well. So, how the relationships and the conversations with these regional support specialists are going to occur, how we want these communication channels to happen, how they are going to be incorporated into the.
Are they going to be reporting to the BHA or to Megan without us? I just want to make sure that, like, the chain of command, or how the flow chart, I guess you could say, transparency for that.
Yeah, thank you for that question, Tasha. And we will have more information. I don't want us to get too far in the weeds on this so that we can stick to reviewing the report, but we will have more information for you in September. Those regional engagement specialists that have now been with us for 1 month and have been onboarding and learning all things about BHA and getting trained on how to engage with underserved communities, they will be coming to all BHAAC meetings. And so we will work on a structure of being able to have information go back and forth so that they're sharing with you all what they're hearing from the communities and hearing from you all as well.
All right. So coming back to our annual report, again, please come in and make some comments. If this is something that we need to start building out a little bit more, if there's some wording that we need to adjust here, again, we want to hear from you all. So please don't hesitate to reach out and start making some of these comments within these reports. So going on to the next bullet point on, how you've been informed so far and additional recommendations for how to be informed and how to have these conversations. So the council is informed about the performance monitoring system through presentations during regularly scheduled council meetings, state websites, and Q&A sessions with the BHA Director of Data Science, that's Jordan Bass, regarding the creation and formal launch of the new interactive public platform, the Performance Hub. Though the council has been informed about this system and the Performance Hub, we recommend increasing the qualitative data collected, not only to identify the services being offered, the quality and access of services being provided, as well as the quality of life persons accessing services during and after care. What are some thoughts, comments, questions, concerns around this? All right, not seeing any too big right now, so take a time, we'll keep moving on. So some of the additional recommendations made from the report subcommittee, and based on, some of the comments that you had made during council meetings, have been as such. So to enhance the Performance Hub metrics by including more comprehensive data that highlights demographic diversity, tracks demographic data gaps, and provide insight into qualitative metrics such as quality of care, quality of life during and after services, and access to care. We recommend increasing data collection of underserved populations, including but not limited to veteran or disabled populations, judicial or incarcerated populations, and or repeat accessors of services that often lack equitable care and procurable services. We recommend incorporating tools for collecting qualitative data, such as surveys, focus groups, online forums, and working with community organizations and local leaders to acquire and develop this missing demographic information. Data.
Caitlin, if I could just make a quick comment on that bullet. If you go up, we sometimes have qualitative metrics here. And I think I would probably take it out right there just to say that quality of care, quality of life, access to care, healthcare disparities, these can both be qualitative and quantitative metrics. They can be structural metrics, they can be process metrics, they can be outcome metrics, and then qualitative tools like surveys and interviews and all of that can be, you can do it, but I think it's a good call out later, but I don't want us to say qualitative every time we mean high quality, accessible services.
That makes sense. Thank you for that. Anybody else? All right. Moving on to our second, coming back to that ADA accessibility. So provide ADA accessible accommodations for Performance Hub monitoring system to ensure that the Performance Hub and its data is accessible, digestible, and linguistically comprehensible for all persons of Colorado. We recommend that the BHAAC increase technology access and utilization by reconstructing the Performance Hub platform so that it's accessible and interactive for both mobile and desktop users. Furthermore, we recommend creating an interactive user guide that demonstrates how to navigate the Performance Hub, how to interpret the presented data, and how to ask questions about a particular demographic or service. So one thing that we were running into here, just during the report subcommittee itself, was looking at the Performance Hub and it coming up on a cell phone versus a desktop, entirely different. And so, before I studied in communications, I didn't even know that that was a thing, but it absolutely is. So we would like that first recommendation about being able to access it and use it interactively the same way via a cell phone or a laptop or desktop computer, however it may be, because we realize that a lot of the communities around Colorado are using this through a cellular form. A lot of people aren't using this as a desktop or a laptop, so we want to be able to make sure that is accessible and navigatable for any type of access, whether it be via cell phone, via desktop, however it may be. Additionally, getting some additional guides on how to, access the Performance Hub and how to interpret the data. Myself, I am not a numbers person, and so sometimes numbers can just be very overwhelming and you don't really understand what the data is trying to tell you or what the numbers mean. And so having that interactive user guide, whether it be, like a pamphlet that you can interact with and things like that, or video recordings that we can do to kind of show, how to access it and how to navigate it. That's something that we can talk about more in depth, especially with Jordan Bass and that whole team, but really realizing that we want this to be as user-friendly and accessible as possible. Tasha?
This just popped into my head, like, how are we going to ensure that the people in rural areas have access to internet to even access this?
So that's actually something that we've brought up with Jordan, not just this council, but multiple other councils. And, you know, that's a very good question that we honestly just don't have an answer to at this time, because we've talked about this with Jordan before, and she's like, yeah, you know, we could do a printed copy, but it loses that interface and that interactive element that is so critical to the performance hub. And so right now, why we don't have a definitive answer on like how we're going to do this. This is something that has been brought up time and time again, and it's something that is in the forefront of our minds and something that we're absolutely going to be working towards, but we just don't have a definitive answer at this time. But we do recognize that it is needed.
The only reason I ask that is because all of Region 2, which is all Eastern Plains, don't have access to internet. Like, or it cuts in and out. You can't do that. So that is going to be an issue with having quality of data, getting the data and the grievances and holding the state accountable all the way across from the eastern side to the western side. You know what I'm saying? So the north to the south, it's just, that's my main concern, is how are we going to make sure that the performance monitoring and the grievance and people have access, all of the people of Colorado have access to the information that they need so they can get the care that they need and hold the state accountable.
Absolutely, absolutely. And yes, I wish that I could say we're gonna give everybody, and you know, like in an ideal world, you know, that would be great. But that is something that not just you, not just this council, it's been brought up multiple times. We're having these conversations. We realize that it is an issue that needs to be addressed. We just don't have a definitive answer at this time, but it is something that is very much on the forefront of our minds, very much on the forefront of this interactive platform and how we're going to be able to address this. So again, let's keep having these conversations. Let's keep bringing it up. Let's keep bringing Jordan Bass into these conversations, and, you know, maybe start throwing out some recommendations if you all have any. But again, this is not something that is just particular to this council, and it is very well known that it needs to be done and how to address this. Because again, if we just give out printed template, like printed handouts, they're not having that interactive user, that friendly interactive user that really makes this performance hub unique and digestible. So again, that's something that we are aware of and are working towards a resolution. But at this point in time, we just don't have a definitive answer. So moving on, we have increased transparency and public participation by informing stakeholders of the quarterly performance hub updates during regularly scheduled council meetings, and demonstrating how council and public recommendations have been incorporated into the performance monitoring system. We recommend that quarterly updates include a one-page report that is presented to the council that highlights the achievements and challenges of the quarter and identifies areas for improvement. So the performance hub team has already spoke and made press releases about, you know, they are updating information quarterly on this platform. So having them come and speak to the council on how that quarter has been updated, what information's been uploaded, what changes to the system occurred, and then again giving you all that one-page report along with that discussion, so you have it as a reference guide, both the audio and visual, to be able to go back and reference and see, you know, the progress and changes that have been made. Any comments, questions, concerns about that? All right. So moving on, we're cooking through this, guys.
Jamie has her hand up.
Jamie wants one. Jamie has
Yeah,
something.
sorry. Sorry, Caitlin. Maybe this is implied in here, and if it is, that's fine. But I do wonder at what point does the BHA and the BHAAC and all of the stakeholders, at what point do we determine if we are capturing the right data in the performance hub and the right metrics? So we can be capturing all kinds of stuff, but it's not really telling us if we're moving the needle in behavioral health,
Mhm.
you know, throughout the entire state of Colorado, or for all populations, or we're underreporting metrics in this particular population, so we need to beef that up a little bit. I can see where that would fall into the where we're capturing public, public comments and all of that. But I don't know. I just don't know if it needs to be called out more specifically, or if what you
We
guys think
absolutely-
about it being
Yeah,
in
we
there.
absolutely can call that out more specifically. So I think that that's how we think of, you all serving on this council, is to come in and do these quarterly check-ins to say, hey, this is what we've been tracking so far. A, what are we missing? B, is this relevant? And continuing to have these conversations, because this is going to be, quite frankly, years of adjusting and conversations and trying to find out the correct metrics to actually, do systems reformation. And so it's going to be a lot of conversation. It's going to be a lot of trial and error. It's going to be a lot of, research on a particular data or metric and then possibly finding out it's not relevant. Again, it's going to be a lot of trial and error, but having these conversations, getting that feedback from both this council, from the public, being able to incorporate that, and then really trying to just fine tune it over a period of time. Unfortunately, this is just not going to be something that, is done in 6 weeks and woohoo, we're done. We're going to have continued conversations. I feel like forever to come, because everything is always constantly changing. The only consistent thing is life is change. And so, we're going to be able to have to capture that throughout the years too. So what might be relevant in our data collection in 2024 might be completely irrelevant in 2045. So just continuing to have these conversations, and that is how we're going to start, really capturing the data and the metrics that we need based off of your recommendations and public recommendations. But if we need to clarify that a little bit more here, we absolutely can. What is the rest of the council's thoughts about that?
Maybe if we're not seeing that is happening, we add it to our report next year
Absolutely.
around more specificity.
Yeah, I think that's a great idea. And again, kind of using this report as like a template to say, hey, we didn't even touch on this recommendation. Let's really highlight this next year, or this recommendation that we made, we didn't get enough of the information that we need. So let's be more specific in our request next year, So I think that's a great idea, Jamie. Thank you for that. Anybody else? All right. For the sake of time, moving on. So our last section of section 2 for the statutory requirements is regarding the behavioral health safety. So the report subcommittee is, continuously working on this report. This is where we're kind of at our current state. So we actually have a meeting this afternoon to, continue to build this out and work on this based off the recommendations, but we really want to hear from you all as well. And then before we jump into that, going down to section 3, as well as the additional recommendations from you all in your lived experience, your professional experience, and your community needs. And then again, how that relates into this council and to BHA and the behavioral health system as a whole. And then just lastly, for reference, here's council approval and signatures. So coming back up to our behavioral health safety net system. So here we kind of, again, break them down into these 3 sections. Want to know how you understand behavioral health, what the behavioral health safety net system is. Any comments or thoughts around it? Tasha?
I just have a concern, and I just want to bring this, like, since we're here, I was going to bring this to the report committee, but since we're here discussing this, access to getting the information that we need. Besides the point of contact with you, when it comes to the whole entire BHA and the different entities, and to try to email and get information, and we're limited to the information. How is that going to help us do our jobs better? Like, with the lack of information from each department, or instead of just going to, like, you, does that make sense? I don't know if I'm wording what I'm trying to say. Yeah, there's a gap with trying to get the information, because there is stuff in this report, as well as other things that I am involved in, that I need a little bit more clarification for, but nobody can answer my questions.
Sure. Can you be a little bit specific in like the information that you're like currently asking for? I know like one example was Bossos, and so you know, using myself as a point of contact, because obviously I'm not a subject matter expert on everything, and but I am, you know, kind of a liaison between you and BHA services, so I'm happy when you all have information or questions that you don't that you're not getting answered, to, you know, be that liaison to get questions answered and put you in contact with the right people.
Like with the procurements, it pretty much with the Bossos, I have a lot of questions with what's going on with the Bossos, because I can't say too much because I'm bound to keep my mouth shut. So I can't say too much, but when I need information so I can be transparent and fair in doing my job and my integrity, and I reach out to, like, what would be you, like where you sit, you know, like what I'm saying on the totem pole, when they don't even have the answers. And then, so how are we all working together as a whole is the issue, and how can we correct that?
Yeah,
Are you guys, I don't know if I'm saying exactly, I can't say too much because of what I'm bound to, like, yeah, so it's kind of hard.
So I think kind of, you know, similar with the discussions that we had around like the identification of underserved populations, sometimes we just don't have the information readily available. And that's not to say that we will never or will never involve you in these conversations or anything. But sometimes, to be quite frank, we don't have the answer quite yet. And that's something that that we're currently working through. And until we can get to a point where we can have those conversations, it's just information that we don't have to be able to present. I don't think it's anything of, you know, trying to ignore your request or anything like that. I think it's just more, you know, work that's something that's being continuously currently worked on.
So is there communication from the top down? Because everything trickles from the top down. So do our deputy commissioners have the answers? Are they giving the information to, like, Megan, and then like where Megan's position is, and then where your position is, and then from down there, like, is that gap being filled? Is the information being trickled down from top to bottom?
Yeah, that's actually something that we're currently working on right now. Our commissioner, she is implementing new policies and procedures for communication channels. That's something that we realized that was currently lacking within the BHA, and that's something that she's actively working on addressing. We're doing a really large internal restructure right now, and creating those policies and procedures that were very much needed. And so we actually have a huge team meeting coming up in September to start, you know, disclosing that information to us, and, you know, chains of command on how to, you know, bring topics up and bring conversations back down. So that's something that we've realized that we needed to address, and that's something that is actively being worked on within BHA right now. Megan?
Yeah, I just wanted to add to that too. obviously, I don't know your specific questions on BASO, so I can't speak for that right now, and I'm happy to talk offline with you if there's anything I can be helpful in that space. But I will say with our regularly, obviously this is a special session, and so you have less BHA representation than we usually do on these meetings. But we do try to have as many BHA leadership join these meetings as possible. So Commissioner Smith has always been on since she started. She's joined every BHAAC meeting at least for a portion to really be here and be involved and give you all updates and opportunity to ask her questions. And then our deputy commissioners, they make every effort. Kelly Cossey usually is on as well. And so we do try to incorporate making sure people are on to hear and have those conversations with you as much as possible, but appreciate you calling that out too. And we'll try to be more efficient in that process, along with what Caitlin just described as improving our communication throughout BHA also.
And I know that I've heard from several of the council members about, conversations with leadership and getting that more inclusive and authentic involvement, because I know right now sometimes it just doesn't feel authentic. It just feels, that we come in, wave, and goodbye. So working with you all to establish, those communication channels and how you want to have that communication and that cooperation from BHA leadership. So that's something that we can absolutely work through with the council as a whole to come up with requests that we can make from BHA leadership about their involvement in their communication to this council. All right. So that's one recommendation. For additional recommendation is to in what ways can we access information that the council needs in order to advise at the capacity it would like. Returning to the behavioral health safety net system, I would love to hear from you all in your individual words on how you understand the current behavioral health safety net system within BHA to be. Tasha?
Can you repeat that question one more time? What that statement one more time, because I just had it and then I lost it.
Yeah. So this question regarding the behavioral health safety net system is, based on the information provided to you all, how do you understand the behavioral health safety net system to be? Do you understand what it is? Do you understand?
Who oversees the safety net providers?
Andrea or Megan, can you help with that one?
Oh, sorry. My camera keeps slowing my internet down, so I apologize if I'm on a slight lag. But the BHA is responsible for approving safety net providers, those comprehensive or essential safety net providers that either do one specific service or a host of services for the comprehensive ones. Those are typically, traditionally, the comprehensives have been our big community mental health centers and some other facilities and interests. And then the essential providers, I don't know where we're at on applications for those, but that's what we could bring back to the council as well. That's what we're talking about when we say who regulates the safety net system over in our provider rules.
From what I understand from the documents that we have, it's, from what I'm understanding, the BASOs oversee the safety net providers.
The BASOs procure, so the BASOs are responsible for contracting with the safety net providers on behalf of the BHA.
Okay, so then my next question, who oversees the boss, or who's going to oversee you guys?
Us,
so,
yes.
Okay, thank
so
you.
The BASOs act as our intermediary, so we don't have to hold a million one-off contracts with a bunch of different providers, right? The BASOs will hold those contracts in the network in their regions and be able to inform us. And we contract with the BHAAC. So we're at the top of that chain. Does that make sense? There are intermediary, like the Rays are an intermediary for HCPF. Perfect.
So coming back to this, thinking about it with regards to different meetings that you all have had throughout the previous years, have you been informed about behavioral health safety net systems? In what capacity have you been informed? Do you understand what they are? Do you need more clarification? And if so, where?
I guess just the kind of the quietness of the group is telling. And it sounds like through the non-responsiveness that we need more education around this. And, I have been in meetings around the safety net system. And I'm, have heard quite a bit about it, but really bringing it all together and showing how it, it relates and helps support the overall behavioral health system. Sounds like this council needs additional education around that. I mean, we should be rattling it off, right? And we can't do that. So that's telling.
Ideally, and that's where, we need to step up and offer you more support and more clarification and more, precise meetings about, the education and deliverables of the behavioral health safety net system, and then get your recommendations based on that, and, identify those gaps and metrics and things like that.
Well, and I think you're exactly right. I couldn't see who said that about education, and also because there are no BOSSOs right now, right? So we're talking about something that doesn't exist. So even when we're talking about this, there's only MSOs currently. So even that education piece, we keep talking about BOSSOs, but we don't know who they are, right? So when we're talking about this BOSSO thing, and then there's silence among the group, some of us that know, I couldn't help but think, I'm well, we're talking about something that currently doesn't exist, right? So that's the education piece too that we need, because a lot of the stuff in this isn't implemented yet, right? We're building the plane as we're flying it. Like we talked about, Caitlin, we're getting the wood and we're building the boat. But I think it's important to point that out, that some of the things in here currently they're just not implemented yet.
Well, and I think to your point too, Doc, is that if my background is the MSO, then what for me, right, Jamie, what is the difference? What are we talking about here? Because for those of us that work within that system, I want to know what will the difference be? How will that change? How will that impact services in my community, right? Because I will be somebody who has to shift to this new system. And so I want to know the impact to my community on this shift. So I would like to see, even some comparisons between the two for those of us that do have that background. What will be the difference on this idea of a BOSSO, right? The idea of a BOSSO, right, Doc? Because it's not a thing. And right, Jamie, those aren't things yet. And how will that impact all of those services across the state? What will the entrance of that look like? How does that change my services to my community every day? Especially for Robert and I, we do, Medicaid services is really important to us to figure out before we, support the system. So I think some more education. I like that, Jamie. Thanks, Bob.
Can we be specific in our requests about exactly, what information you're looking for, so we can kind of use this to build out conversations to have in future council meetings? So That way we're not just coming in and being like, behavioral health safety net, what are our intentional questions? What are exactly are we looking for within trying to understand this system?
Yeah, I can help with that because I know where I was when they first got launched, right? What's the difference between a safety net and an essential provider? Also like, what's the difference between those two and what we had previously to those two, right? Like, what are the differences? Because we're talking about improvements, but we don't really know if you don't have the base of what was there previously, how do you know what's been improved? And then how do we know if it's improved if you don't know what was there before, right? So it's kind of like if you're watching, the reboot of the original, I'll use for Andrea, I'll say, if you didn't see the original Crow, how do you know what the new Crow movie's gonna be? You don't know if it's
I know
gotten
she loves that.
worse. If you're
We'll have to talk about that, Dr. Rob. Yeah.
So I guess my question is, we need to create a baseline of what existed before. Then we need to talk about how safety net improved upon the first one. And then we need to talk about how essential is even deeper than safety net. And then also as a provider, I know there's things that have been improved and boxes that were checked that were never checked before, like the BHA ran the backgrounds of the leaderships of each program. That had never been done before. That they're making sure that certain Medicaid, certain things involving getting people back on Medicaid, certain indigent things that didn't exist, certain timeframes where services had to be provided. There's all kinds of cool things that happen. I mean, there's all kinds of cool things that are stressing providers out, but there are cool things that are happening, right, for safety net and essential that weren't there before because it was the Wild West, right? So I think there needs to be education from what was there, what's the improvement, and where we're headed. Because if we're talking about something and we're saying like, if you don't know what was there before, we don't know what's improved. Do you know what I mean? And then that gives us also the ability to grant grace for things that are new. Like if we're like talking all kinds of like, I'm so frustrated with this about the safety net, but it's brand new to them as well, then we should know that, right? So that we're not coming at them hard for something that they're still trying to implement. So again, I think that, we have all these lofty goals and expectations, but we should talk about like, what was there first? Do you know what I mean? What was there? Where's our baseline? What are the changes so that we know our expectations of like, okay, we're a year in. I know this is a year old, but it hasn't gotten better here with this provider, certain providers. So I just think that's the education piece. I would start there and just bounce off from that. So if somebody has a list of what was there before and what safety net created and then what's essential gonna have, I think all of those things are great. And then I think also, this is also just a Rob bugaboo, but can we always, when we're with the BHA, are talking about the mental health centers. There are so many other providers out there. Like, can we just please, we know they're there. We know they're there. We know they're there. Let's talk about some of the other smaller providers also and get some education on that, because some of the demographics that aren't getting served can go to these other providers and not have to wait in this long line for somebody that's really willing to help, wants to help. And so, yeah, I would just throw that all out there.
Absolutely. Jamie.
So well said, Dr. Rob. I would just add also that what does this look like for the consumer, right? I mean, is the consumer expected to know what essential and comprehensive and safety net, or they just know I need this service and where do I go to get it? And we don't need to worry about all these definitions. We do that on the back end, right? So how does this look for the consumer as it relates to safety?
So true. I never have a crying parent call me and go, hey, I'm looking for a safety net provider.
Not one. Yeah, because I think that's what I was saying. It's like, how does this translate? How does it translate to to the person that's in my inbox today. That's literally, you know, and that's the reality of my community. It's like still in my, you know, Facebook messages. People I need, you know, my son needs it in this community. I agree. I think it's back to how does this affect our community members in our neighborhoods?
Andrew.
Just plugging the safety net, and that sort of piqued my curiosity on this one. One of the biggest things I think that is of import to this council with the safety net is those approved safety net providers, like I was talking about, the comprehensives and the essentials, have no refusal requirements for their service populations, which did not exist before. This was one of the biggest accomplishments of the safety net, is these providers are not allowed to turn very vulnerable community members away because they are approved to do services at that higher level from the BHA, and that's part and parcel of their obligation. So it's a true safety net in that regard, and that's where we're starting from foundationally, just for framing for this council and why it's so important in your communities. Does that help?
That's a great example.
Okay.
All right. So these 2 hours flew by. I know that we're almost at time. Wanted to quickly highlight again this section 3 is additional recommendations based on personal and professional experiences as it relates to the council and BHA. So I would love for you all to come in here and make some comments, suggestions, again, as it relates to you as individuals within your community, professionals, and things like that. And please just be sure to tie this into, you know, the larger behavioral health system as a whole, this council as a whole, and things of that nature. So again, I'll be sending out a follow-up email about that, and we would love to hear your feedback. I will give like a deadline to be able to incorporate that feedback, just so we have enough time to work with the report subcommittee to incorporate that, to finalize this report and get it out to you all by the 28th. And then similar for the direct feedback process for BOSOs, you know, a lot of the feedback process that we've recommended thus far is, you know, quarterly check-ins during council meetings, quarterly one-page reports. If there's something else that you would like with specifically for these BOSO relationships, please come in and make some comments and, you know, just support your argument as to why you would like it done a specific way. And then lastly, since we reached quorum for like 5 minutes and then people had to jump off and leave, so we won't be holding the formal vote for our officers during this meeting, but that will be the first and foremost thing that we do at our next meeting in September. And then Raquel and Tasha, I will just go ahead and start working with you all. So that way when the formal vote officially does happen, we can just up and run for September and potentially even have you all lead that meeting, just so we don't get any farther behind. Again, the recommendations are based off of your all's nominations, but since there wasn't a formal vote taken today, there won't be a formal officer for next meeting until we formally vote you in at the very beginning of September. But that's kind of where we're at today. So also wanted, I don't think we have any members of the public on right now, but if we do, just to give a little space to come in and comment. Hold that for a moment.
I just want to jump in and I just want to give my thanks to everybody that nominated, put in their nomination for me for co-chair. I appreciate you guys and I promise to lead and work with you guys with complete transparency and accountability. So thank you guys. I appreciate it.
Thank you, Tasha. All right. Any last minute comments, questions, concerns for the good of the group? I know this was a lot of information and discussion being thrown at you all today, but I think that this is just an amazing start to, you know, refreshing this council and really getting on track and being specific with our conversations and really being able to advise and in a capacity that this council I know can do. And I'm just very thankful for you all and very thankful for the time and effort that you've all put into this, because I know it's a lot but I think this is great work and is laying a wonderful foundation for the next year and future meetings to come.
I personally want to say thank you. This felt a
That's
lot
what I was
better. And I also want to say, Caitlin, and I don't mean this disrespectfully, but everybody who gives Ryan a hard time about talking fast and reading fast, like needs to also put Caitlin involved in that, right? So you could join our hip hop speed rap band because Caitlin, it's like Bone Thugs and Harmony, you're flowing fast. I have to like catch my breath to keep up.
Well, thank you.
It's a
But I do
policy
agree.
division skill set. Yeah.
Yeah, I think I just like kept watching the clock. I was like, oh, gotta go. You know, I think hopefully if we can transition into the 90-minute monthly meetings, we can slow things down and have some more actual conversations as opposed to like information overload and me just rapping to you all. But I both appreciate and agree with that. So thank you, Dr. Rob. All right, everybody. Well, we'll give you 2 minutes back, but thank you again for taking the time to meet today, and just keep an eye out on your email because we're going to have a lot of information coming your way over the next couple of weeks, and looking forward to getting this finalized and seeing you all again in September. All right, thanks everyone. Have a good rest of your afternoon.